This is Dr.Ben with FitFootU, and today I am here with an old colleague. He used to keep me laughing, Luke Cicchinelli, but he's also a very accomplished podiatrist in Spain. So you've been in and out of Spain 28 years. You practice in North Carolina. I visited you once there. I learned some good practical tips. But you've noticed some things in the health system in Spain, maybe not access to as much secondary, tertiary studies, so the practitioners have learned how to do some good technological studies in their own offices. Maybe highlight some of the Spain differences that you've seen that are useful for us in the US.
Well, so in Spain, the Podiatric Society came to surgery kind of late, and so they learned to develop their skills more in a sports medicine rehab kind of diagnostic sense. One technology that's used really frequently now that I haven't seen really here in the United States is thermography. You can basically buy a thermographic camera, attach it to your cell phone. You can screen every patient that comes into the office, and essentially you're looking at temperature change. Basically the differential between one foot to the other, for example, is only 0.3 of a degree. And then in gradations of 0.3 of a degree, you can start to identify a lesion that is not yet problematic, possibly going to become problematic, alarming, now a definitive issue. You can even, for example, look at nerve entrapments, and you'll see that they are a colder area on the foot because it's not an inflammatory issue. It's actually the vasa nivorum has been constricted, and so that will register as cold. So thermography is used as to help mount and dissect out differential diagnoses. There's advances in endoscopy and tenoscopy for diagnostic tools, minimally invasive, endoscopic procedures, Haglund's resections percutaneously, even percutaneous Haglund's resection, FHL tendon transfer into the heel, all done through little tiny incisions, ostrigonum resections.
You were telling me in Spain ultrasound's very popular too.
Ultrasound in almost all the offices, basically used preferentially over MRI. Why? Because it's less expensive, more available. It's operator dependent. There's courses all over the place for docs to get trained on it, and it's a dynamic real-time exam. Take a look at a plantar plate injury, for example. A runner comes into your office, and these don't have to be surgical cases. This can simply be doing a differential diagnosis, real-time ultrasound dynamic exam where you can actually see the ligaments, plantar plate, lateral ankle.